How to interpret complex kidney cancer scan reports. Interpreting complex kidney cancer scan reports can feel overwhelming, but understanding key components can make it easier. These reports provide vital information about the tumor's characteristics, extent, and potential spread, which are crucial for post-treatment care and long-term follow-up in kidney cancer management. First, let's look at the imaging modality and protocol. Kidney cancer scans typically use contrast-enhanced computed tomography or magnetic resonance imaging. A computed tomography scan is often done in multiple phases, before, during, and after the contrast injection. This helps highlight the tumor's vascularity and anatomy. If a computed tomography scan isn't suitable, a magnetic resonance imaging scan may be used for better tissue characterization. The report should specify the type of scan and the phases used, as these details affect how we interpret tumor enhancement and size. Next, we need to focus on tumor characterization. The report will detail the tumor's size and exact location within the kidney. Tumor size is critical for staging and treatment planning. Another important aspect is enhancement. An increase in density or signal intensity after contrast administration indicates vascularity typical of renal cell carcinoma. The report may also describe the tumor as solid or cystic, with complex cystic masses classified by Bosniak criteria, which help assess malignancy risk. Staging details are often included in the report, following the TNM system. The T stands for tumor, indicating the size and extent of the primary tumor, including any invasion into surrounding tissues or major veins. For instance, T1 tumors are confined to the kidney and smaller than 7 centimeters, while T3 or T for tumors indicate local extension beyond the kidney. The N represents nodes, which shows whether nearby lymph nodes are involved. Positive nodes suggest a higher risk of cancer spread. Lastly, M stands for metastasis, indicating the presence or absence of distant metastases, such as in the lungs or bones. The report should also assess adjacent structures and any metastasis. It should comment on the involvement of renal veins or inferior vena cava by tumor thrombus, any enlargement or abnormal appearance of regional lymph nodes, and evidence of distant metastases, often checked through chest imaging or additional scans. Kidney function and chronic kidney disease considerations are also important. Since kidney cancer treatment can impact renal function, reports may include kidney function tests. This helps guide long-term follow-up and management to preserve kidney health. Finally, the report may include recommendations for follow-up. It might suggest further imaging or biopsy if findings are unclear. In post-treatment care, serial imaging is used to monitor for recurrence or progression, focusing on any new lesions or changes in previously treated areas. For practical applications in long-term follow-up, regular imaging intervals depend on the initial tumor stage and treatment type. Understanding the scan report helps patients and clinicians discuss prognosis and treatment effectiveness. Recognizing signs of recurrence or metastasis early allows for timely intervention. Coordination with laboratory tests that assess kidney function ensures balanced cancer control and kidney health preservation. In summary, interpreting complex kidney cancer scan reports involves careful evaluation of tumor size, enhancement, staging details, and evidence of spread, integrated with clinical and laboratory data. This comprehensive understanding supports effective post-treatment monitoring and long-term kidney health management. Always discuss scan results with your healthcare team for personalized interpretation and care planning.